Hello, everybody. Welcome to another episode of Holistic Health Hour. This is Dr. Kevin Connors, where we're going to do our best to answer some of your health questions holistically from a natural perspective, however you want to say that. Okay, so remember, you can go to holistichealthhour.com. You can see all our past episodes, very well indexed on different questions that people have asked. So if you got a question that you can't get in on, please do that. And you can chat in your questions today on that holistichealthhour.com site. You can ask questions, and that's where we're getting these questions from. People have asked questions in the last week. So let's jump to the questions. Number one, I have come across some suggestions of different B vitamins and things to add to someone with Parkinson's disease. Is this something you would recommend? And have you found that Parkinson's can be reversed? Well, that's a tough question. Parkinson's, can it be reversed? Parkinson's is typically an immune attack, many times an autoimmune attack on part of the brain called the substantia nigra, which is the part deep in the midbrain. That's the only part of the brain that makes dopamine, and dopamine is essential as an amino acid, as a neurotransmitter for smoothing out movements as far as its connection with the frontal motor cortex and the cerebellum. And a deficiency in dopamine leads to a disease called Parkinson's disease. Can taking supplements help? Yeah, cleaning up your diet can help. Decreasing the brain inflammation is probably your best help. Supporting through, typically for the medical intervention, is medication that's going to replace dopamine, L-DOPA. But problem is that tends to only last for a period of a couple years, and then it just doesn't work as well anymore. So it's a progressive disorder, and there isn't any magic medicine that is going to cure Parkinson's. However, what has been found is that inflammation in the brain is at least a contributor to it. Matter of fact, you can test for neural antibodies and get a pretty good idea that you have a possibility of early Parkinson's, or you can catch it at an early stage and you can start doing some things about it. So the test that you would test for that would be a Cyrex Array 7X, which would test for neural antibodies. It's not a perfect test, but it's a good indicator of all sorts of different inflammatory markers that have caused antibodies to neural tissue that you can now start to make interventions. Usually people only do that test after they've had neural symptoms, meaning some upper motor neuron symptoms, some early Parkinson's, some early dementia, though it would be better to do it before you have those symptoms and you can start being more proactive. However, what do you do with that if that's positive? What do you do if you already have a Parkinson's diagnosis? Well, you have to decrease brain inflammation. That's your number one purpose. You got to find sources that are causing an increase in inflammation in the brain. So decreasing brain inflammation, you think of different nutritional supplements like flavonoids, curcumin, boswellia, stinging nettle, that kind of thing, quercetin. Those are the flavonoids that can help increase brain inflammation. But if you have a source that's causing an increase in inflammation, well, you're never going to win that battle if you don't decrease that source. So dealing with food sensitivities, gluten is the most common thing that's going to cause brain inflammation. Certainly dairy, other food sensitivities can cause that. Looking at tests to measure blood-brain barrier permeability issues and working on that and improving that can be beneficial. Increasing oxygenation to the brain. One of the best things that I've seen for people with Parkinson's is to do hyperbaric chamber. The negative of that is you have to do it on a regular basis, meaning daily. So it's almost better to have a hyperbaric chamber in your house. Certainly different supplements can be beneficial. but I'd really concentrate on the anti-inflammatory things with Parkinson's, and I'd really concentrate on finding sources of inflammation. Okay, next question. When using, let's get to the chat question here. How does the SBI Pro dietary supplement work to assist in follicular non-Hodgkin's lymphoma? I've just begun using that. So the SBI Pro supplement is a immunoglobulin. So there's a lot of different immunoglobulin supplements out there that can be really helpful for the gut. So immunoglobulins taken as a supplement are to help decrease the inflammation in the gut. So they kind of act like a sponge to grab onto stuff in the gut to get it out of the gut. So it decreases inflammation in the gut. And remember, when you have inflammation systemically, whether it's inflammation in the brain or it's inflammation in the tissues, when we decrease inflammation in the gut, we're going to decrease systemic inflammation. So the purpose of doing, so how's lymphoma? Why would you do work on gut inflammation if I have lymphoma? Well, working on gut inflammation can help systemic inflammation. So it can help any disorder. Speaking of Parkinson's, working on it, I mentioned one of the major components of Parkinson's is trying to find sources of inflammation in the brain. And I mentioned dietary things like getting rid of gluten and dairy and things like that in your diet. And people might go, what is he talking about? Dealing with gluten? I have Parkinson's. How does that relate? Well, you have inflammatory processes that go on in the gut are going to cause inflammation systemically. So anytime you can decrease inflammation in the gut, you're going to decrease inflammation systemically. So that would be the mechanism of action there. Next question. When using alternative therapies for cancer, that is Rife, supplements, diet, etc., and tracking my tumor markers, how can one interpret I had a 10-point rise in the first 2 months of alternative therapy, and most recently only a 5-point rise within a month? Is that a positive improvement, or if the amount of increase is less than previous, or is there any increase a negative sign? Okay, so how do you interpret a tumor marker test when you're doing any type of care? So for those who don't know, who don't have cancer, tumor markers are different proteins that different cancers may or may not give off. So let's use CA19-9 as an example. So CA19-9 is a tumor marker. Now there are dozens and dozens of different tumor markers. Let's use your PSA as an example. So PSA, more people are more aware of. PSA, prostate specific antigen, is a tumor marker for prostate cancer. Now that's only going to be for prostate cancer. So somebody is not going to have an elevated PSA with colon cancer. But some of the other tumor markers are not as specific. So like CA19-9 that I mentioned, that can be elevated with pancreatic cancer, that can be elevated with breast cancer, that can be elevated even with colon cancer, though not as common. But if a person has prostate cancer, 99% of the time their PSA is going to be elevated. But if a person has pancreatic cancer, there's a much smaller percentage of the time their CA19-9 will be elevated. Maybe it's 80% of the people with prostate cancer. I don't have those statistics. But with breast cancer, there are several tumor markers. There's CA15-3, there's CA19-9, there's CEA, there's CA27-25. And those should be done on every woman with breast cancer because one woman might have an elevated CA15-3 and another woman might have normal CA15-3 and an elevated CA19-9. So it isn't guaranteed that your cancer, if you have cancer, that your tumor markers are going to be elevated. But the benefit of doing tumor markers is that it gives you a non-invasive way to measure progress if your tumor markers, if you do show one or more tumor marker that is elevated, it gives you a more non-invasive way to measure progress of care, meaning that, okay, I have to go get a blood draw to measure my tumor markers versus going to get a CT scan or MRI or PET scan. Those are fairly invasive. MRI, well, you still have to get gadolinium as a dye. That can be invasive. CT scan is radiation as well as PET scan is radiation. So, and cost-wise, it costs you less than $100 to do a tumor marker panel. It costs you $20 to do a PSA test. So it can be less invasive. You could do it on a more regular basis. So you could do tumor markers on a monthly basis. So this question is being asked, if I have an elevated tumor marker, let's say this person has breast cancer, let's say their CA15-3 is elevated, and as they're starting a course of care, whether they're doing standards of care, whether they're doing alternative care, the numbers are going up. And as through that course of care, let's say it's the first 2 months, it's gone up 10 points. Well, when was your first baseline? Well, you always have to get a baseline, and it's a shame that more oncologists don't run tumor markers right away when a person has a diagnosis of cancer, because then that will give that person a baseline. So wherever we draw that baseline of that first blood test, and then you're measuring subsequent blood tests to see, which direction things are going. If things are slowing down and starting to level out and starting to go down, that's what we want. But many times when you start a course of care, your baseline is, let's say, whatever it is, 53 on a CA15-3. Let's say it went up to 63, then 73, and then it's down to 68, which would be a similar interpretation of this person's question. Is that a good sign or a bad sign? Well, to me, it's not enough data. So, you could have a 5-point swing in a tumor marker test, and it doesn't give us, it doesn't tell us. What you're really looking for a tumor marker test is it really, except for PSA maybe, but your CA19-9, 15-3, and 27-25, is it like doubling? That's where you get concerned. When a number goes way up, that's when you start to get concerned. When it's just crawling up and then crawling back down, we don't really know that we can assess care components at that time. The second part of this question is any increase in negative sign. Well, yeah, you don't want your numbers to go the wrong way, but it can take time for things to change in your body, to heal in your body, to attack this. I will say one of the reasons why oncologists don't like to use the tumor marker tests is they will state that they're not very accurate. And I will give them the okay on that answer, because they aren't very accurate if the person is doing chemotherapy as well. So what chemotherapy does is chemotherapy, hopefully, if it's working, it's going to destroy a cancer cell through a process of lysis. So it's going to cause that cancer cell to die quickly. And it can cause a spike in tumor markers. So when tumor markers were first discovered years ago, it was this huge aha moment for the practice of oncologists. We're going to use tumor markers to monitor this person's care. Problem is, what is an oncologist recommending? Well, they're recommending chemotherapy. And what was found was that when a person is doing chemotherapy and you're getting rapid death of cancer cells, you can get a spike in the tumor markers because the cancer cells are dying, and then you're spilling out this enzyme, the tumor marker, and it will show in the blood that it's elevated. And people would freak out. Oh my gosh, I'm going through chemotherapy, I'm feeling sick, you're telling me that it's getting better, you're running this tumor marker test, and it's doubled, tripled. This is not good. But it's a false positive. So when a cancer dies quickly, it can spill out more tumor markers, and it can give a false positive of an elevated test. therefore, a lot of oncologists have scrapped tumor markers. That's why they don't run them, because they're expecting everybody to follow their course of care, which is chemotherapy, and they got tired of explaining to people that that can actually be a good sign when you get a spike of a tumor marker. It's hard to explain that to a person when you're saying this is a good way to monitor our care. Um, but when you have a crawl upwards and a crawl downwards, you have to have more time to assess those numbers. Um, be careful to put all your stake in anything, whether it be a CT scan, an MRI, or a PET scan, or blood tests. You want to look at trends. So trends are the most important thing that you're looking at. You can have these false changes, your blood changes. Remember, it's just taking a sample of your blood and it's measuring what's in that sample. And that can, other things can cause variation of all your blood tests. So you want to look at things over time, and you want to look at things in connection to other things. So any objective test that you're doing, you want to measure that with other objective tests and with subjective findings. So you don't take one test and you make a clinical decision completely based upon that test. You take that test and that gives you clues. So tumor markers are the same thing. It's my tumor markers going up. Well, that gives us clues. Could the cancer be getting worse? Could we just be putting the brakes on the cancer at this point in time? What are your other things that you're looking for? How does the patient feel? What are their CBC and their complete metabolic panel telling us? What are, has the patient's symptoms changed over this period of time? How has it changed? So you look at as many different markers as you can to make a clinical judgment, and that's how you go through the process of differential diagnosis. So hopefully that will help. Next question. I have a TrueRife and was wondering if I cover it with my sheet or if I am under a blanket, does it lessen the effectiveness? No. So it'll still go through your clothing. You don't have to have a skin-to-skin contact with a Rife machine with a bulb. So the farther it gets away from you, you decrease the effectiveness. So if you have the bulb, 12 inches away from you, it's not going to be as strong as far as the amp output and penetration of your body as if it's right next to you. If you have it 4 feet away from you, it's going to be even less penetration. So the closer it is to you, the better. If you have a sheet over it or your pajamas between it, that's not going to be an issue. Okay, this person asked 2 questions very similar. I have colon cancer with metastasis to my lungs. Recently have had laryngospasm twice, which is very scary. Is there a thing I can do at home to help with this? Thank you for advice. So laryngospasm can be from multiple different causes to that. So, but when a person says they have metastasis to the lungs, then it's always a concern that is there the cancer that's in the lungs, where is it? Is it putting pressure on a nerve that's causing the laryngospasm? Is it a space-occupying lesion that's pressing on the airflow? I don't know for sure. So we really need more data to help with this. Dealing with metastasis to the lungs, you think about what other things you could do to help with the metastasis to the lungs. You think of hydrogen peroxide nebulized. Make sure you follow the Dr. Mercola nebulized recipe for hydrogen peroxide. You don't nebulize straight hydrogen peroxide. You have to water it down. You think of cordyceps is a good supplement as far as lung inflammation and lung healing the lungs. Anything that's going to decrease inflammation will also be a benefit to this person. Cordyceps is a medicinal mushroom that is also an adaptogen, but it's really good for the lungs. Those are the things I would think of. And you'd want to get more data, though. Is it the space occupyingness quality of the lesion in the lung the issue? Is it the location of that lesion in the lung that's putting pressure on a nerve? Is it pressure on the airflow, bronchial passages? You want to get a little bit more data to find out what the cause of that is. Question from the chat. Would you advise to use the Rife machine program parasites all frequency in combination with using ivermectin and alternating fenbendazole on a monthly basis? If so, how often? No, I would not. So a purpose of cancer patient using ivermectin and fenbendazole isn't to kill parasites. So, well, I thought those were anti-parasitic medications. They are, but that's not the mechanism of action with using those off-label drugs for somebody who has a diagnosis of cancer. It works differently to help stimulate apoptosis. That's how they work, not for the sake of parasite kill. So, can a person with cancer also have parasites that would make them want to use the Rife parasite all frequency? The answer is yes, you can. That's a possibility. So there's not anything wrong with doing the parasite program on the Rife, but you wouldn't do it in conjunction with fenbendazole because thinking that that's why I'm taking fenbendazole is because I have a parasite and that's the problem and the cause of my cancer. It's a different mechanism. So hopefully that answers that question. Will lowering inflammation help kidney function? If I consume too much salt, my legs and ankles swell up for several days. I have rare occurrences of gout. Blood tests are normal except for my GFR, your glomerular filtration rate, which is 65. Okay, so will lowering inflammation help kidney function? Yes, lowering inflammation will help pretty much every organ and tissue. As far as a person reacting to salt, if they have too much salt, their legs and ankles swell, that could be an issue with kidney issues. So obviously, if your GFR is elevated, we have kidney issues, possible kidney damage at some point in time. And an excretion of salt is an issue, and that's causing you to retain your water, causing the leg swelling. So yeah, absolutely. So trying and lastly, the thing about salt, a person can have a salt sensitivity that's very common with different autoimmune diseases. There's been different labs. I think I go into that. I think I shared some of the research in the autoimmune course about salt sensitivity. Why some people will have salt sensitivity, and salt increases their blood pressure, and some people can eat salt like it's high on the food triangle, and they don't have any issues whatsoever. It has to do with a salt sensitivity. Some people it is a trigger. So we talk about autoimmune diseases and looking for triggers. Salt can be a trigger. So the interesting thing with people that have salt as a trigger for autoimmune issues, if they take fairly higher dose of potassium with a salty meal, then it doesn't cause a problem. It basically negates that trigger. That might be something to look into too. But definitely, if you're holding water, you want to make sure that you're helping increase kidney function and help with detoxification pathways. Our course on detoxification, the 7 phases of detoxification, goes into that a little bit too. Um, uh, as far as gout goes, so gouty arthritis is an inflammatory arthritis. So um, if if you have issues with gout, you know you have issues with inflammation. Um, and you think, oh, well, I got swelling, so I have inflammation. Well, that's inflammation because of water retention. But definitely, if you have episodes of gout, you have um, inflammatory processes that are going on. So looking for triggers for that inflammation are going to be really important, and trying to decrease the inflammation is going to be really important. I've had patients that have had, you know, rheumatoid arthritis diagnoses, or gouty arthritis, or psoriatic arthritis, the inflammatory arthritis diagnoses, and you just literally change their diet and their pain goes away. It can take several months, but we've seen their pain just literally melt away. And it's because you're eating foods that are inflammatory to your body. You go back to the what's inflammation in the gut is going to be systemic inflammation. If you're eating foods that are inflammatory in the gut, you're going to cause systemic inflammation. And then you can get a diagnosis with all sorts of different names, and it gets down to cleaning up that person's diet, cleaning up their gut. That's going to bring health to so many areas. So that's what I would highly recommend. Start there. Next question: how can I get an assessment on supplements I need for detoxification? I have DNA, enzymatic health issues, and have been currently using some of your products: PON1 Assist, Pro SOD Catalase, CBS BHMT Assist. So for those that don't understand, those are supplements that are specific for different gene pathways. So if people have genetic defects in their PON1 pathways, which is a liver phase 1, phase 2 pathway assist, that's how you get rid of toxins, chemicals, pesticides, things like that. If a person has done a genetic workup and they have a lot of defects in their PON1 pathway, that might be a product that that product was specifically formulated to help with the PON1 pathway. So if they have defects, a lot of defects in the PON1 pathway, we might recommend, or a practitioner might recommend, that product called PON1 Assist. Same thing if you have defects in your superoxide dismutase catalase pathways, they may recommend SOD catalase. Or a practitioner may just recommend SOD catalase if they know they're exposed to a lot of oxidants, because SOD and catalase are antioxidants. And the same with the CBS BHMT. Their CBS is a specific gene in the glutathione pathway. Your BHMT is another gene family. If you have defects on those genes, then those products might be recommended. Continue with the question: to help get rid of toxins, but looking beyond this because I do not feel well, GI, neuro, circulation, etc. I would like a personalized recommendation protocol to address my personal needs. Yes, so if you want a personalized recommendation from us, you will want to start with what's called a case review. So if you go to our website, connorsclinic.com, you'll see a tab that says start here or begin here. You can click on that. And connorsclinic.com is mainly all about cancer, because that's our primary patient members that we see these days, but have for years. But we also have a sister site called My Hope for Lyme. Similar, but it talks about Lyme disease, it talks about autoimmune disease, it talks about general functional medicine. It doesn't make a difference which site you go to. You can self-schedule on either one of those sites. Matter of fact, I think the My Hope for Lyme site pushes you back to the Connors Clinic site to schedule now. And I think that's the page that you'd go to schedule now. Certainly, you could just call the clinic and talk to Maureen or whoever answers the phone and ask them about options. But you'd start with a case review if you want help from us, I mean. So if you want my help, you start with a case review. That's a 30-minute consultation with me. We'll do a phone consultation. And we'll go over your symptoms. I may make recommendations for different labs. And we want to look at the labs that you had done so far. And you talk about, okay, I'm supporting these genetic pathways, but I still don't feel well. Well, you're missing something. So is it something as simple as a food issue? Is it something as simple as dealing with neuroinflammation? Also on our website, there's 1,000+ different blog posts with videos that go over a lot of those things. So if you're having specific neurological symptoms, you can search for those on our blog search, on our website search, and you may find more information that will help you. But you want to work with us, you'd want to start with a case review. If you want to work with somebody else, I would hope that they would recommend labs that would get to the bottom of it, because you always want to get to the bottom of what is the cause of your issue. And most of the time it's not genetic. It's something functional that's going on. Question from the blog: is it okay to take diatomaceous earth, food grade, for extra cleansing if you have breast cancer? General answer for that is yes, it is. If you haven't started it now, the only recommendation with that is to start at a lower dose. Start maybe a teaspoon a day for a period of time, and you can work up to maybe a tablespoon a day or something. But no, there's no really negatives to that. Diatomaceous earth is really a binder more than anything else. It can help sweep the gut, similar to SBI Pro. But immunoglobulins help decrease the inflammation probably a little better than diatomaceous earth. But diatomaceous earth acts more as a binder in the gut, which is good. It's fine. It can be an anti-parasite in the gut as well. So yeah, it can be a good thing to do. There's no real downsides to that. Some people can have sensitivities to it, meaning it doesn't do well with them. And I don't think it's like a antibody sensitivity, but I think it just is an irritant. So I would start slow with it. Next question. We have observed our 25-year-old granddaughter that seems to have some struggles. Has issues with eating, repeating her words, anxiety, had a meltdown. She maybe have history of vaping. Supposed to be doing a candida cleanse, has an itchy area on the back of her neck spreading to scalp. Do you have any suggestions for low income help for chirofunctional medicine? Okay, so I fully understand that question, but issues with eating, issues with repeating her words, anxiety, had a meltdown. I suppose that means an emotional meltdown. History of vaping. So vaping, what does that pertain to? Anything with a history? Well, it pertains to tons of toxins. So there's a lot of heavy metals, a lot of poisons in that vape products that people are using. So that can lead to toxins. But going back to the symptoms, I mean, I don't have I don't have anything close to complete history on this person, but issues with eating, repeating her words, that was a key phrase to me. Anxiety and emotional meltdown, that speak to neural inflammation. So that's the thing I would look at. History of vaping, maybe other sources of toxins. You think of possible toxicity in her brain. Supposed to do a candida cleanse because she has an itchy area in the back of her neck spreading to scalp. Would candida be one of the first things I think of? Not unless she had other candida symptoms. Certainly, you can have lots of different comorbidities. When we get ill, it's usually not, oh, here's the problem, we'll just take this out or fix this and now all my problems go away. When we get ill, it tends to be a domino effect and multiple things go bad. So a person can have parasites and heavy metals and candida issues and toxicity to their brain, and they can have all these things that are going on at the same time. And usually that's what happens. That brings us, our bodies are pretty resilient, but it's when we get this combination of all these things, breaking down our barriers and that overwhelm our immune system, that can end up lead to cancer, that can overwhelm our body and can lead to autoimmune diseases, where our immune system starts making antibodies against self-tissue. So you have to start to kind of uncover the layers with any type of disorder. You're kind of breaking down the layers and cleaning things up. So I'm not a functional medicine doctor who thinks everything begins in the gut and everything is solved by this, because the best way to know what's going on is to run some labs and run some tests. But like this question mentioned, a lot of people are in a situation of they don't have money for labs. I don't have money to do this stuff. I don't even have money to make a case review with you and get started on a call. Well, that's where we have our courses. Our courses are $50. So doing the autoimmune course for $50, where I'm constantly adding more material and more information, where you can start going through some videos and learning how to take care of yourself, is the best way to go. Problem is, a lot of people that are in this situation don't have the motivation to want to take care of themselves. Well, then I don't know what to do in that situation. Hopefully that this person, 25 years old, is getting to an end, getting to a bottom where they want to start taking self-responsibility. It's very difficult when you have a person that doesn't want to take responsibility for themselves. It's hard enough with a kid who you're trying to force into a dietary program that they're not willing to do. It's certainly impossible when a person is an adult. So they have to be willing to do some things. You can lead them to some information. So if you join one of our courses, you join our autoimmune course, and you share information with them, from a grandparent to a grandchild, I don't know how open or willing they're going to be to receiving that information. But I'd start with just uncovering things. And the way to uncover things is to, first of all, try to decrease the toxic load this person is dealing with. Sometimes when you just start decreasing the toxic load, the body has an unbelievable way to heal. Meaning, are there inflammatory foods that this person's eating that they need to get rid of? Is there support with detoxification pathways? Stop vaping, stop their poor diet. It's amazing what you can do when you just, all you do to a person is clean up their diet, getting them eating better and doing a little bit of exercise and thinking better about themselves and taking responsibility and decreasing their medications that they're taking. How the body can respond and healing can take place without buying a whole bunch of supplements or having to do anything else. So start with what you can do, I guess, is the way to do it. So next question, how do you deal with a possible PANDAS case? My nephew is having issues. So PANDAS, for those who don't know what PANS and PANDAS is, PANS and PANDAS is basically inflammation in the brain. PANDAS is caused from strep. But they're finding, so when it was first discovered as a strep infection, can cause damage to neural tissue, cause microglial priming, and severe emotional breakdown of that person. It was typically in children, and it was from strep. So it was basically an untreated strep that went to the brain, caused neural inflammation, neural damage, many times neural antibody production, and severe emotional changes. So a PANDAS case would be, a typical PANDAS case would be a normal, healthy, happy 7-year-old, a child that maybe came down with an infection, and then literally 2 days later was this completely different person. That's typically what a parent would explain. This is not my child. Somebody kidnapped him overnight and replaced him with a different child. They're defiant. They're angry. They're banging their head against the wall. What has happened? Do they have autism? What is going on? That's what PANDAS is. It can be, now they're finding that it can be not just strep related. That's what PANS is. So, and it can be not in just a child, it can be in an adult too. So there can be multiple different causes, from mycotoxins to mycoplasma, different bacterial infections, different viral infections, post-concussive disorders. So more and more data is coming out on this. Treatment can be, if strep is still present, can be antibiotic therapy to decreasing inflammation. So everything that I have on a video that I created a few years ago that was more specific to microglial priming and neural antibody production. And it's, if you go to the website, I mentioned this on multiple Holistic Health Hours. If you go to our website, search neural inflammation, you'll see a video that I created on neural inflammation and microglial priming that talks about decreasing brain inflammation. So those are the things that you would look at. But you do want to do some discovery and some labs to see exactly what's going on. You have to deal with diet, because diet, you got gluten and dairy, which are gliadomorphine receptors in the gut and in the brain, and casomorphine receptors in the gut and the brain. That's going to cause direct inflammation of the brain. You have to look at, from an autoimmune perspective, you have to look at other triggers that be causing changes in mood and changes in behavior. Dealing with, if it is mycotoxins, dealing with that. If it's heavy metals, dealing with that. Those would be detoxification. If it's like a mycoplasma, dealing with that, that'd be using like Rife or other anti-infectious agents. So they're complex cases, but you can see changes and turnarounds in these people, and people get their child back. So, but not things to take lightly. Neural inflammation is real. That speaks to that last question too, when there's changes in behavior. When you talk about repeating words, anxiety, emotional meltdowns, those are all what are called upper motor neuron issues, meaning those are brain issues. So you have to deal with sources and causes of brain inflammation. So look at that video, neuroinflammation. Go to our website, search for that. Go to our YouTube, search for neuroinflammation under our YouTube channel or our video channel. And you'll see it's about a 30-minute video on microglial priming. I think that will be well worth your time to go through that and watch that. Make an appointment with me, and we can talk about some tests that we'd want to run as well. Okay, what is the best natural way? Hold on, let's see if this other questions came in there. Yes, I'm going to get to that question too. Do you advocate for more of a whole food, plant-based eating, especially for cancer survivors like me? I followed Chris Wark's program, and that's the approach he takes. So curious what your thoughts are. So always a whole food diet is best. So whole food is eating the whole thing, and eating foods that we were in the best way that God created us to eat those foods. So that's a whole food diet. Plant-based eating, is that the best thing to do for cancer or someone to prevent future cancer coming on? No, not always. So everybody's different. So can a plant-based diet be the right thing to do for a person if they have cancer? The answer is yes, it can be. Can a plant-based diet be the wrong diet for a person with cancer? Yes, it can be. Everybody's different, and sources of cancer's growth can change over time. So a person's on a plant-based diet and their cancer goes into remission and they're doing really well, and then the cancer comes back. So they've been on this plant-based diet. What's the deal? The cancer's found another fuel source. So you need to change your diet. If you can't figure that out through testing, and we do kinesiology testing to figure that out, but if you don't have that available to you, you have to just change your diet. So cancer is constantly trying to find a fuel source in order to grow. So if it's not, a plant-based diet can be through a plant-based diet, you're still getting different proteins, you're still getting amino acids through that, and you're still getting glucose. So lots of times plant-based diet with cancer involves juicing, which could be high in increasing levels of glucose. And if glucose is your main source of that fuel for that cancer, that could be very much the wrong diet to be on. So everybody's different is my answer. So I don't say that every cancer patient should do this or that. Now, there are some things that you could make generalities about with cancer, but not everything. So no, I don't advocate for a plant-based eating for everybody. And another diet that's common is a ketogenic diet for cancer patients. There's books written about every cancer patient should be on a ketogenic diet. And my answer to that is no, that's not right. Everybody is different. Would a ketogenic diet be good for me? Maybe, but maybe it's going to be the very wrong thing for you. Ketogenic diet is going to be obviously much higher in animal proteins, and if your cancer is fed off of glutamine, then it's probably not the right diet for you at this time. So everybody is different. Another cancer diet that has been common is a raw food diet. Is that good for everybody? No, it's not. So typically a raw food diet is going to include obviously raw whole foods, like this person is asking this question, and juicing, which is going to be higher in glucose. Also, you got to think of a raw food diet is going to be more appropriate the younger a person is, because they're going to be producing enough digestive enzymes to deal with the raw food, not cooked food, which takes a lot more pancreatic enzymes to break down than if you are eating your food that's more cooked. And an example would be if a person has really bad gut issues, you put them on more of a GAPS type diet. A GAPS is food that's really broken down. Maybe they're only eating soup or they're only eating bone broth. Now, I wouldn't use bone broth with cancer patients, but I'm using this as an example of that's all they can tolerate at this time, even a young person. So everybody's different. I don't take a one-way approach to cancer. And I don't even take a one-way approach to that specific person, because that diet for that person can change. So we might have them on a whole food plant-based diet for a period of time, and we switch them to being more of a carnivore for a period of time. So you have to be willing to change things up, because cancer is always changing and always trying to find a fuel source. So if that worked for you at that time, that's great. But just be aware that it might not always work for you. And what worked for you, be careful not to tell everybody that you just need to do this because this worked for me. Because it doesn't work for everybody. Nothing is going to work for everybody. All right. I think we have time for one more question. Should I have my amalgam fillings removed and replaced with composite fillings? Is composite okay or just as bad? Composite is acceptable, and it is not just as bad. So your amalgam fillings, your silver fillings are bad. They're very bad. They leach into your body, into your mouth, and you will swallow that mercury. Now, if you had perfectly healthy gut in a perfect world, you'd probably deposit that in your toilet. You don't have absorption sites for mercury. However, the fact is that everybody has some level of leaky gut, and you will absorb that, and it's going to cause problems. So if a person has a diagnosis of cancer, should they have their amalgam fillings out? My answer to that is if they're healthy enough. So, and it also depends on the level of dentistry that's going to be involved in removing them. I just have 3 small fillings. I went to a biological dentist who's going to do it the right way, use a rubber dam, have a mercury vacuum, use a nasal cannula, have something over my nose so I'm not breathing in the gasification of that filling when he's drilling it out. So he's doing everything right. And he said it's going to be fairly easy removal and replacement. Then the answer would be yes, but you also have to ask, am I healthy enough right now? If, boy, I'm going through chemo, I've really been sick, then I'd say, no, wait. If no, I'm feeling great, then I'd say, yes, go for it. However, if the answer to those questions were, oh, I got mercury in all my teeth, I mean, it's just horrible. It's going to be this major dental intervention to deal with this. I don't know. Sometimes it's better to leave sleeping giants lie. It's difficult. I've had patients with cancer that literally their teeth are just filled with mercury. I mean, they literally should probably have all their teeth removed and just go with dentures. That would be the safest and healthiest way to deal with things. The problem was, I remember that patient, they were so ill when they came to see me that they wouldn't have been able to tolerate any intervention at that time. So you have to weigh those factors out. It's never, ever good to have mercury in your mouth. You always want to get your mercury fillings removed. But you got to weigh out the level of intervention that's going to be necessary in that process and the current level of health. And I made caveat 10 that you're going to a biological dentist who's going to do it the right way. The worst thing you could do is just go to your dentist. He said he could just remove it. He told me, oh, it's no big deal. He's just going to remove it. It is a big deal. You have to do it right. You have to go to a biological dentist that's going to use a rubber dam, that's going to use a mercury vacuum, that's going to use a nasal cannula, that's going to block your nasal passages, that you're not going to breathe it in, and they're going to do things correctly, and they take it seriously. So otherwise, you don't do anything with any other dentist. Okay, I think that's all we have time for today. Remember to go to holistichealthhour.com, holistichealthhour.com, where you can ask your questions via the little box there, and then we have a better chance to get your questions answered. There's a few that we didn't get to, we'll get to next week. And you can go to connorsclinic.com and search our blog posts. We have lots and lots of them, and you may find answers to your questions there. You can always make an appointment with me on the self-schedule or call the clinic as well. God bless, and we'll see you guys next week.